sometimes the things we talk about are irritations, but this is really literally in some cases a matter of life and death today. We're talking about medical claims for patients who suffer from rare diseases, and what happens if that funding is turned down by a medical scheme and they try to utilize the right that is available to them to appeal to the Council for Medical Schemes. We have an organisation representing people with rare diseases flagging the fact that it is taking far too long to see that appeal process through, and the result is that patients are literally at risk of dying while they wait. Now, Wendy, earlier this month, both of us received an email from the patient advocacy group Rare Diseases South Africa. They, as I said in the introduction, offer support to, but also lobby on behalf of patients whose medical conditions are uncommon and quite often require very specialized and very expensive treatment and medication. And the statement they sent out expresses outrage and deep concern over what they've characterized as abuse, and widespread abuse at that, on the part of medical schemes. Effectively, they're saying that when medical aids refuse to cover a patient's expenses, the appeal process that is legally meant to be available to that patient is being drawn out so long as to make it almost pointless, Wendy.
Exactly. So that statement came from Kelly du Plessis, who is the founder and CEO of Rare Diseases South Africa. And this is what she wrote. Medical aids are taking advantage of the inefficient and poorly capacitated appeals process facilitated by the Council for Medical Schemes. Now, they're the regulator for the medical schemes industry, as a delay tactic to avoid funding life-saving treatment for patients with rare diseases. That is a pretty serious allegation, yes. The organization recently launched its Dear Minister of Health campaign, which aims, among other things, to give patients and healthcare users a voice when it comes to the shortcomings of the private healthcare system in South Africa. Kelly says the problem is that only people who've gone through the process will understand. As a general user of healthcare, you have no idea until one day you need to use the process and find out, and then possibly it's too late. Patients can wait for years to receive payment from their medical aid for treatment of a rare disease. Without treatment, which is unaffordable during that wait, the condition of patients deteriorates to the point where some die or cannot be treated. So as you say, Pippa, a very, very serious matter indeed.
And we have Kelly du Plessis on the line with us who wrote that statement. Kelly, again, the founder and CEO of Rare Diseases South Africa. Kelly, thank you very much for joining us and welcome to the show.
Thanks so much for having me today.
Before we talk about the appeal process, Kelly, how many patients on your database are in the position of having their medical aids regularly declined to cover their treatment and medications? Does it happen to just a handful of people, or is it dozens or maybe more?
It is quite a significant proportion, taking into account how many patients actually have a treatment available. Obviously, in the rare disease space, only 5% of rare disease patients have a commercial treatment.
Okay.
So, sure. But over that 5%, we see this issue often. Many times, obviously, there are other issues at stake, such as lack of awareness, lack of data, lack of appropriate clinical trials, etc., because of the rarity of these conditions.
Yeah.
But we find that this issue crops up a lot when it comes to the more expensive and innovative therapies, obviously because it's a cost-saving mechanism for the scheme. Our reason for saying that it is an abusive process is the fact that very often when we get to an appeal and on the day that the appeal is due to be heard, sometimes this is only 3 years down the line, then the scheme withdraws.
Wow.
And there's been no material change to their benefit design, to their exclusion process, to the patient, to their ability to access this product.
A patient who is in the position of having the medical scheme refuse to cover their treatment, again, the system exists in place. They are legally entitled to lodge a complaint with the regulator, the Council for Medical Schemes. In your experience, Kelly, how often does that appeal process result in the finding being overturned and the scheme being ordered to pay?
Well, generally speaking, our complaints are ruled in our favor as well. It's the scheme that lodges the appeal. They will decline a patient, and once you've gone through their internal disputes, you'll lodge a complaint with Council for Medical Schemes, who 95% of the time will rule in our favor. And then the scheme makes the decision to appeal Council's ruling, and then that complaints ruling decision is suspended while you wait for that appeals process. So if the medications call it R1 million a year, and the scheme waits, that process takes 2.5 years. The schemes have saved themselves R2.5 million.
Sorry to cut in there, Kelly. You might remember, Pippa, and the listeners, we covered that case, I think it was pre-COVID, 2019, I think, of the father whose daughter was born out of wedlock, but had a right to be on the
his
scheme.
medical aid, yes.
They denied it initially and then put all sorts of restrictions
on.
Remember
Yes.
that. And he appealed. He went to the CMS and was ruled in his favour, very strong worded. Do you remember?
That, yes.
And then the medical scheme concerned lodged an appeal, which has still not been heard.
No.
Yeah, so this
3
is
years
exactly, it's not
later,
about
yeah.
rare disease, but it's about the abuse of the appeals system.
That is exactly the problem. That is exactly what we're trying to alleviate. And the issue comes in is that Council for Medical Schemes' defense is that they're undercapacitated, that their appeals board only meets every second month, and that they're doing the best they can. And our question is to the minister to say, well, hold on a second. This is the prescribed process that you as the minister have set out for us in the Medical Schemes Act. It's not fit for purpose. It either needs an overhaul of the system, or you need to provide the Council for Medical Schemes with whatever resources are necessary for them to be able to effectively rule on these decisions in a reasonable time frame. We've had patients lose their ability to walk and talk. We've had patients die waiting for a ruling.
You have flagged in this campaign not just the fact that its system is not working as it's designed to work right now, but you're very worried about what potentially happens if the national health insurance kicks in, because this procedure is meant to be replicated to include the NHI as well, not so?
That is correct. Yeah, it's the same process that's detailed out, drafts that are in circulation at the moment. And we're saying, hold on, if we can't get it right for 16% of the population that's generally better capacitated than the public sector, how on earth is the same process going to be functional for 100% of the population, where you don't necessarily have the same access to tools and resources as that private medical scheme members have access to today?
What then is the solution? What are you campaigning for to happen to put this right, and who are you engaging with as an organisation?
So first kind of step for our process was to understand, because whilst we see this often in the rare disease space, we wanted to be assured of the fact that it's not just our community. And it is very, very apparent that it isn't. So we launched this campaign site asking people to share their stories. Tell us what issues you've had in terms of accessing healthcare on a day-to-day basis. And there's been lots of common threads about the same sort of thing. Then our next step was to engage with Council for Medical Schemes, which we have done. We have sent mails. They have confirmed that they have had a 56-day reduction in their complaints process. So the initial complaints process used to be 120 working days.
Yeah.
It's now been reduced to 120 days, which is a 56-day reduction and is a great start.
Yes.
But the appeals process, which is where all the expensive and complicated things go, is unfortunately not mandated in the Act. And now the next step is to address the minister on either changing, putting forward regulations that amend this so that there are dictated turnaround times that have to be stuck to, or alternatively, then they've got to do better in terms of providing the resources to have the appeals board meet more frequently.
We do have a response from the Council of Medical Schemes because, Wendy, I know you reached out to them.
I'm quite relieved to have got it, actually, because I emailed them and then emailed them again, and I was losing hope, and the response came in
just in the nick of time.
Just in the nick of time, and it's very long. Let's try and pick out the important bits. The CMS is mandated to protect the interests of medical scheme beneficiaries at all times, and as such, it is quite concerned about the long turnaround times and the implication for members' health. To counter this, the Appeals Committee has increased its sittings. I don't know if Kelly is aware of that, or whether they increased it to every second month.
Kelly, is every second month an improvement on what used to be the case? Do you know?
I think it's an improvement from every third month now to every second month. But,
Okay.
I mean, it's not really groundbreaking.
It's nowhere near good enough.
Okay,
Yeah.
thanks.
Okay.
I'm glad we kept you on the line. The CMS statement continues. According to our internal standard operating procedure, appeals should take 90 days from when the member or the medical scheme appeals after the complaints process has been completed. Despite this, the CMS tries its best to expedite rare disease cases as soon as they are received. Well, 90 days.
3 months. That's long.
I mean, we're sitting with cases that one case that we were very involved with is now into the 3 years.
Yes, yeah.
So, Kelly, there is a turnaround time that's stipulated, but clearly it's not being adhered to. Is that the case?
Look, I've literally never had a case heard in 90 days ever. The appeal time frame, the time that you've got to lodge your appeal, is certainly mandated. We've got a case that's we had to send a legal letter for it to be set down, which has been set down at the end of this month, 714 days and
Wow.
counting.
Wow.
Yeah. Okay.
For a rare
Nearly
disease.
2 years, yeah. And as you said, to reiterate what that means in practical terms, that can be a massive decline in health, in quality of life, in independence, in mobility.
For someone who
and
can't afford the
in
drugs.
The ability to be able to have successful treatment, because sometimes in that 2-year period you're put beyond the point of being able to help at all, which is that's the reality of what we're talking about.
With specific reference to rare diseases, the CMS says, we note the growing concern over the treatment of rare diseases and we're handling the issue with the seriousness it deserves. In addition to engaging with the concerned individuals and stakeholders, Kelly, I think that's you, a comprehensive statement position and additional CMS script on the subject will be issued. I think that's what they call it, sort of a press release.
Yeah.
Will be on the subject will be issued in due course. They've said a rare disease working group meets monthly to pursue this cause, and they've spelled out their objectives, the usual stuff. Ultimately, the submission on the status and funding of rare diseases will be made through the CMS to the National Department of Health for approval to improve access to treatment of these rare diseases for all South Africans as part of the PMB review process. So to the listener that phoned in and said that his wife's condition was not on the list, there's a little glimmer of hope there. And they've said CMS has accepted arrangements where patients are managed by state central hospitals and private service providers. These arrangements are subject to the terms negotiated case by case and are acceptable on merit. The member, therefore, might end up with a combination of private and public healthcare services where necessary, and that in some cases there are special clinics for these rare diseases in a few tertiary hospitals with a private section for medical scheme patients paid by the scheme upfront. This might not be available in all provinces. I hope I've done a very long press release justice.
In the pressing there. I mean, Kelly, would you like to respond to anything else that you've just heard Wendy mention from that release?
Yeah, I mean, look, I'm grateful that they have responded. There's scripts and circulars. I mean, we've had previous circulars issued that left me with great hope, only for the medical schemes to turn around and say that they're not binding.
Oh.
So, I mean, they make quite clear their position on certain issues that we've debated ad nauseum. And the medical schemes are just of the view that, it's not worth the paper that it's written on and it's merely a guideline and they're under no obligation to follow it. So, and, it comes back to herein lies the problem. At what point where does the buck actually stop? And I'm very, very grateful to hear that they are planning the Rare Disease Access Initiative that they refer to, the monthly meetings. We are part of that.
Yeah.
We were one of the conveners of that meeting of that group initially. It's very encouraging to see that they are wanting to put recommendations forward for the national department. But I can't stress the urgency in terms of them actually doing that.
Yes, I wanted to say we definitely want to check back with you on this issue in the months to come. And I think tell some of those stories, obviously anonymously, but some of those stories where people have, as you say, lost the ability to talk, lost their lives while waiting for the appeal to happen. I think making that, putting faces and to this
humanizing
issue,
the problem,
humanizing it, I think is the way to go, and we'd like to be a part of that. So we'll be in touch.
Now, Wendy didn't stop at asking the Council for Medical Schemes for advice. She also sought another view from somebody within the medical industry, Wendy, and that was Mark Hyman.
Yes, he's the founder and CEO of MediCheck, which is one of a few companies in this country, obviously there being this need for an interface between the patient and the doctor and the medical schemes to kind of step up and help get these claims settled. I ran the statement from Rare Diseases past him and asked for his comments. His initial comment was, this is a complex discussion and an extremely contentious issue. So we're
let's let him explain why, because he's with us on the line now, founder and CEO of MediCheck, Mark Hyman. Welcome to the show.
Thank you, Pippa, and good afternoon, Wendy, and to your listeners.
Complex and extremely contentious. Would you like to expand on that a bit?
Okay, so the complexity of the issue is that rare diseases, and not all of the rare diseases, are not necessarily listed in the 11,239 ICD-10 codes which are the coding system that determines a disease and whether it falls within the parameters of what is confirmed as a prescribed minimum disease as per government gazette. So that's the first contentious issue. There is a move towards updating those PMB conditions that were originally set back in 2013. So, the first review started only in 2015. We're now in 2022, and that is now starting to happen. So I think that the work that is being done, and I must compliment Kelly on the work that she does, and the fact that there is an understanding within the Council for Medical Schemes, within the Department of Health, that these reviews need to be constant and ongoing.
Yeah. Mark, my understanding is that somebody who has got one of these rare conditions and really has to fight tooth and nail to get their medical schemes to recognize the treatments and the drugs, etc., a lot comes down to the drafting of a medical motivation that their healthcare practitioner helps put together to motivate to the scheme why it should be covered. Do you want to tell us a little bit more about the importance of that?
I think that's the critical element. The key is in the drafting of a high-quality motivation to a medical scheme. I do believe, quite honestly, that medical schemes, and the majority of them, there are the exceptions, the majority of them will apply their minds where a motivation is effectively written in terms of clinical data, not purely providing anecdotal data on drugs, providing information with regards to the actual realities of outcomes. Unfortunately, and I think this is possibly where one of the biggest problems lies, is in the fact that our medical professionals, our specialist physicians, are very thin. And they are very stretched in terms of the work that they're doing, the number of patients that they're seeing, particularly in extreme prescribed minimum benefit conditions, particularly in terms of rare diseases. A 2-page motivation to a medical aid from a medical specialist will get a view, will be reviewed, will be looked at, but there is no depth in the actual motivation. And I think that's where one of the problems lies. We as MediCheck do provide the ability and the capability of actually writing on behalf of the member with the full approval and consent of the medical professionals, together with our own medical professionals that we have involved in our business, together with the drug companies providing the most recent and relevant data that I once again stress is not anecdotal, but is actual outcomes-based. And that's where I believe, to a large extent, the differences come in terms of making sure that medical aids actually pay for these particularly high cost and particularly new drugs and innovative drugs that are coming into the market.
Mark, thank you very much. Mark Hyman, the founder and CEO of MediCheck. And if you are listening to this going, boy, I wish there was someone like that to help with my claim, check out their website, which is medicheck.net.za, if you would like to see the kind of services that they might be able to help you with. Wendy, a really important issue, and obviously one that's nowhere near being resolved yet, but I'll be interested to see whether the pressure and the publicity that's been garnered by the campaign that Rare Diseases SA has started is going to see a change. For example, those every 2 months meetings becoming, there should be every 2 weeks maybe.
At least monthly to start with. Yeah, interesting issue, because on the one hand, that whole appeals that the regulator and their lack of capacity to deal with the complaints, and then from the other end at the beginning where the quality of the motivation is so crucial, important. Yeah. So a professional able, and certainly in this one case that we heard about, to present an argument so compelling, so irrefutable, that the medical scheme then
has no choice.
Pretty much has no choice. Yeah, so it's a sort of different side of the same issue, but let's hope by ventilating it on all sorts of platforms such as this one, that there is some positive change. And it's a story I certainly would like to follow up on.
Keep tabs on, absolutely.
Yeah.
Lunch with Pippa Hudson
on Cape Talk.